It's a big problem in our state and right here in Lucas County. Babies are dying before they even celebrate their first birthday.
Yeah, and Melissa was just looking over some statistics, and what's more troubling, in fact, in Ohio, a black infant is nearly 3 times more likely to die before turning 1 than a white child.
Amanda Fay breaks down those troubling numbers and takes a look at what's being done to get our babies to age 1.
It's just another year where we're looking at, babies dying, and it's a cause for concern.
Words Toledo Lucas County Health Commissioner Eric Skidzinski has uttered far too many times. Statewide, 929 babies died in Ohio in 2019. That's actually down by about 10 babies from the year before, but that's not the trend in Lucas County. In fact, the infant mortality rate increased from 7.4 in 2018 to 9.4 in 2019. That means for every 1,000 live births in the county, nearly 10 babies died. And when you take a closer look, an even more troubling trend, the infant mortality rate for black babies grew in Lucas County from 13.7 to 15.9 year over year. Statewide, racial disparities continue to widen as well, while in 2019, 518 white babies died in Ohio, the lowest in a decade. 356 black babies died, meaning a black infant in Ohio is now 2.8 times more likely to die than a white baby.
Those individuals, aren't here to grow up to be adults, and we need to make sure that we're doing everything we can to again get that gap narrowed and get to close to zero as possible.
So what's being done to save our babies? When I last dove into the numbers nearly 3 years ago, the black infant mortality rate was lower at 14.2. With efforts to reverse that trend, why are the numbers still going in the wrong direction? Lucas County's Getting to One Coalition program coordinator, Codell Cook, says he can't pinpoint one specific reason.
We're still kind of diving into our data to figure out, which factors to really focus on, so that we can really steward our work and target our efforts there.
Cook took the position about 2 years ago and says one thing he's noticed in the time in the role is the lack of consistency with addressing the racial disparity across agencies and organizations working on the issue.
It's not enough to, just have a conversation, about it quarterly. We have to continue these conversations month in, month out, really daily.
So what does the Getting to One Coalition do? A lot of things, really. Neighborhood navigators are like a support system for pregnant and postpartum moms, focused on meeting immediate needs.
If a pregnant woman needs baby items, we will provide referrals to that specific service.
And then there are certified community health workers like Jada Barnett. We first met her in 2018. She visits families on a more long-term basis, providing support before women even get pregnant.
Making sure that their health, their body, their social, emotional, all of that is in place, intact, and their bodies are in the best shape possible. So when they do decide that they want to start having children, they're able to do so and carry that pregnancy.
Barnett says as she interacts with families, a big issue she's coming across is confusion.
Families with women not really understanding the different programs that are out in our community and what type of services those programs provide.
And she says the pandemic is adding more complications to an already delicate situation.
Parents having to be teachers as well as moms, the parents running the household, and especially if they're pregnant or just delivered a baby, trying to balance all of those things out.
And she says that means many times the last thing a mom wants to do is hop on the phone or Zoom to find out about services and education available to them. And Cook says that's where Getting to One has to follow up.
We can literally lose a client or participant, right, if we don't, really focus on our follow-up and be consistent with that.
As far as reversing the trend, Cook says while he'd like new programs over time, the biggest thing is focusing on existing programs and its 3 subcommittees.
We really want to restructure our subcommittees based upon what the data is saying, right? What are the top priority issues that we need to be focusing on.
The number one cause of infant death, Cook says, is prematurity. So that means a greater focus on prenatal care, addressing things like mom's age, weight, and habits like smoking. Those are the issues Barnett takes on with her families. As a mom whose daughter was born weighing less than a pound and is now a blossoming 12-year-old, she gets it.
When I am helping them, assisting, it's not just someone who is just trying to collect data on them and reach numbers, whatever, but it is someone who has walked their shoes.
Cook says we all need to talk about racial disparities and social determinants of health in order to really attack this problem.
It's a call to action that our coalition, really wants to put in the forefront, put out, in the forefront, right? It's a conversation that, it can't any longer be swept under the rug.
Cook encourages you to ask pregnant women you know about the types of clinical and social services care they're getting and encourage them to call the Getting to One hotline or visit the website or Facebook page to get linked up with vital services. We have all of that information for you on our app and website. For WTOL 11, I'm Amanda Fay.
And Melissa, in January, Ohio Governor Mike DeWine announced a new Eliminating Racial Disparities in Infant Mortality task force that would meet for the first time to try to develop a strategy for reducing infant mortality rates and eliminating racial disparities by the year 2030.
We're told no one from Lucas County's Getting to One coalition is on that task force.